love is really the minimum we should be doing as health workers. You know, it's the best medicine. It's why we It's not complicated. So when people say we don't have time for nurturing care, I sometimes wonder, do they know what nurturing care is? And you all have the capacity for nurturing care. We should all be implementing nurturing care. Does that make sense to you? So every contact should be an opportunity. And you know, love is really the minimum we should be doing as health workers. You know, it's the best medicine. It's why well, I hope why you all went into the profession, because you care and love for humanity. And nurturing care is all about that. That's why I love that we have to do a lot of cup feeding. And ensuring that the mother's supply is kept up is critical. And how can you do that? Skin to skin contact. His bones are being formed, his blood is being made, and his senses are being developed. To him we cannot answer tomorrow. His name is today.
That okay?
No, you can share it.
Okay. Thank you.
This is our nurturing care area, and we have toys that are for early childhood development, and these are an innovative toy. It's the breastfeeding doll, and you can see we do. It's nurturing care, but it's innovative in that it integrates nutrition, early learning, responsive caregiving. Breastfeeding dolls.
Breastfeeding dolls.
First ones in the country.